Let's move on to the forum wrap-up. We have some closing remarks. Next slide. So I wanted to highlight some of the next steps that we'll be taking starting in the next sort of 3 months and then continuing on for the rest of this fiscal year. Some of it you've heard briefly about and some I'd like to highlight moving forward. Next slide. The first is resuming site visits. I know for many hospitals that are on this call, we had an in-person site visit with you about a year ago. We've had some virtual site visits with some hospitals that are participating today, but it's been some time since we've engaged with hospitals individually to understand what are your very specific barriers and facilitators to doing this work, and what are some of the resources that we could provide to help you move this work forward. And so please be on the lookout for correspondence from us about restarting site visits that will of course be virtual. Second, and this is a big one, we to date have focused on the care of opioid exposed newborns, but we would like to broaden our quality improvement efforts to include substance exposed newborns and their families. Now, we initially focused on OENs because there's a withdrawal symptomatology. If we were going to do work in this space, this population was almost felt like lower hanging fruit in that there was something that we could monitor, something that we can change very explicitly in our neonatal care plan, versus substance exposed newborns that are not necessarily opioid. There might be some symptomatology of withdrawal, but honestly, there's no good way to assess it, and there's certainly no treatment. And so when we broaden our focus on SENs, we're then broadening our focus beyond the baby, beyond the infant, and to the family, because that's where the critical interventions are going to come in. How do we best support these families? Because there is no biologic therapeutic modality that we can give like we do to our opioid exposed newborns who might have really severe withdrawal. And so we're in the early stages of trying to brainstorm what our quality improvement collaborative looks like as we broaden. Clearly our data set's going to have to change. Some of our key drivers will need to be adapted, but that being said, things that we have focused on around parental engagement, breastfeeding, safe discharge, that clearly is applicable to this larger population of affected newborns. The third is key driver focused efforts, and that you've heard from each of our steering committee members who are focusing on specific key drivers. And so there'll certainly be more to come around that. To date, it's been sort of one key driver focused on one or two hospitals, and moving forward, it's really expanding the number of hospitals that will try out these very focused key driver PDSA cycles. Fourth, engagement with MAT centers and providers. So as we heard from the Massachusetts experience, focusing on the newborn is just not enough. And so we know that even if mothers are in MAT and they're receiving treatment throughout pregnancy, and their babies may actually have a longer length of stay. More of them may need farm therapy, but in the end, we know that that is a better outcome for that family unit. And so we know there is really a critical need to engage with MAT centers and providers to, first of all, educate them about the work that we're doing, but also for CHoSEN Quick to learn from them. So how do we then provide continuity of care for mothers instead of really just focusing on the babies, which is what we've been mainly doing today, sort of hospital-based care for the opioid-exposed newborn. And again, highlighted by Massachusetts, the engagement and education of outpatient pediatric providers. And the first couple years of CHoSEN Quick have really been focused on hospital-based efforts, and we really are trying to branch out into engaging with our outpatient providers to understand what is it that they're experiencing with these infants and their families. Because thus far, we don't really know if we've shifted the burden of care of these infants to the outpatient setting. The last two items that I'll highlight are work that we're doing as part of our data and research working group as part of the SEN steering committee in collaboration with CoLab. The data linkage project is one of the first in history that links history of Colorado, I should say, not of the US, that links maternal and infant records and follows longitudinally over time so that we can identify substance use disorders in a robust way and then assess what are some of the short-term and then longer-term outcomes associated with use. In addition, it's linked data, therefore it's linked to Trails data. And so we'll have a sense of understanding what are some of the factors associated with Trails reporting and a number of other outcomes collected by Trails. We're eventually hoping to link then with a database that's called the All Payers Claims Database. So this is all healthcare related billing for moms and babies. So then we'll have data around inpatient, outpatient, emergency room use, pharmaceuticals, etc. So providing a much more comprehensive picture of how mothers and babies are impacted after that initial assessment of substance use disorders. And then lastly, our qualitative study. As Stephanie Bork highlighted, she's been undertaking the work to understand family experience during birth hospitalization. Well, this qualitative study is more longitudinal in nature. We want to identify mothers in the prenatal period and really follow them over time through the first year postpartum to understand what are some of the barriers and facilitators for obtaining resources and for obtaining the supports that they need to really thrive during the perinatal period. So there's a lot that's upcoming and we're so excited to engage in this work with you. Next slide. As I mentioned to our family advisory board members who shared their amazing experiences with us, our numbers don't clearly tell the story, and it's really the personal shared experiences that are so impactful. And this was personal testimony that was shared with me by Stephanie Bork in her work around the qualitative interviews that her group has been conducting. And so I would just like to share this with you all. This is the testimony of a mom who was impacted by neonatal abstinence syndrome with 2 separate children. And here she describes her really different experience with the first child versus her second child. And so she says, with my son, this is her first, I didn't even get to go down and see him for a couple days. With her, this is her second child, which is more recent, in a hospital engaged in CHoSEN. With her, I was able to engage from the start. This time, at least, my ability to breastfeed or give my milk isn't limited by anything like medications like last time. So even if I'm not doing skin to skin for longer than a couple minutes, when I do it throughout the day or it varies at night, I try to get in as much as I can for her comfort at sleep and my milk production. I'm glad that the ESC thing is in effect, whether they're not having to administer morphine, but I know that if she needed it, that says morphine, they would have it already. And so clearly her experience the second time around is much more inclusive, where she feels as though she is part of the care and well-being of her infant. And so this to me really encapsulates the positive outcome of the work that we all are doing. So thank you. Next slide. Now I'll pass it over to Jamie to talk about next steps for CPCQC.
Thanks, Susan, and thanks everyone. Great day. So thank you for participating. I want to share information. Hopefully some of you had the opportunity to participate in the breakout session and get to meet Valerie and Katie from our team. Their contact information is easiest if you just go info@cpcqc.org. So if you're interested in participating in the collaborative that will kick off in January to address comprehensive screening for pregnant people on admission for delivery, you can reach out to us, get your hospital signed up. We already have about 6 hospitals that are committed. Some of those are CHoSEN Quick hospitals. So it'll be really amazing to see all the work happening with pregnant people, infants and postpartum people at the same time and really connecting those dots. So feel free to shoot us an email, get in touch and hopefully join our collaboration. And also part of that, just to put another pitch in for something I heard today, that there is a great need for education and changing the culture around stigma, bias, and really being able to deliver trauma-informed care. We will have some continued training opportunities in 2021 for providers to attend regarding that. So look forward to those opportunities as well. And thank you.
Thank you, Jamie. Next slide. Next, we'll hand it over to Jade from Illuminate.
All right, can you guys hear me okay? My microphone's doing weird things.
Yep, we can hear you.
Good, thank you. Well, thank you all so much. I will echo the sentiments of a really fabulous day, specifically to our family advisory board members. Amy, Ashley, Felicia, and Diane, I will just say you brought me to tears on multiple occasions with sharing your stories. And there was so much power behind your words today. And so first of all, I just wanted to say thank you to them. And then thank you to all of our providers on here that are clearly committed to making changes and to addressing what we heard from our family advisory board members and also what we see in our data, and to really building a brighter future for kids and families in Colorado. In terms of system level work, you'll see here, and I mentioned earlier, we still have our substance exposed newborn steering committee. That's really our umbrella, if you will. So that's thinking kind of most 50,000 foot view. What is it that we can do to make sure that we are continuing to move this work forward together? So from the steering committee level, partnering with our family advisory board, and then all of the different work groups, we need you to help us make sure we've got the right priorities and that we are implementing those in a really meaningful way. So we have strategic planning coming up at the end of this month with the steering committee, and then we are looking towards a town hall or some other way that will be ensuring that we can get input from all of you on kind of draft priorities and strategies and activities and what that all will look like moving forward. So stay tuned there. And then the only other thing that I wanted to share, similar to what Jamie said, is, I also heard today this desire around peers and peer connections and, really the opportunity to connect with someone who's been through it before. And I mentioned briefly earlier our Circle of Parents in Recovery support groups, but those are parent support groups that are really intended to be parent-led, parent-driven, for parents in recovery, led by parents in recovery. We have funding for those. We have a big federal grant on that. So if any of your hospitals are interested in learning more about what it might look like to host one of those groups on site, please reach out at any point in time and we can get you connected with the folks on our team that have the resources to get those set up. So thank you all so much, and I look forward to continuing to work together.
Great, thanks so much, Jade. Next slide. All right, well, we are nearing the end of our session, and so we'll be doing one more Mentimeter question. And so we ask, what's the one thing you'll take away and or do differently today? So please chat it into the link that Cassie will provide, and there it is. Terrific. And to highlight, I really do want to thank and highlight Cassie Davis. If we were in person, we'd all stand and give a big round of applause. She is our organizer extraordinaire in making this forum happen from start to finish. So thank you very much, Cassie. And to all of you, thank you so much for your participation today. You'll be receiving a follow-up email with materials from the event, and the process recordings will be posted to the CHoSEN website and shared in the CHoSEN quarterly newsletter at the end of the month. Please complete the evaluation with the link that's right there that Cassie just posted. Again, thank you so much, and we hope you have a great evening.